Hi everyone, this is Dr. Merhaut from Elite Sports and Spine Chiropractic. Today with the Elite Education Series, we're going to be talking about the TMJ, so jaw pain and basically what the TMJ joint is, what type of dysfunction can occur with that, and the pain that people often complain about with the jaw itself. So the TMJ is the joint within the jaw right down here that attaches up to the skull. It's the temporomandibular joint. This joint is constantly moving, obviously, when you're talking, when you're eating, excuse me. When a lot of times people have pain while they're sleeping, or they wake up with pain because they grind their teeth. This can be related to stressful scenarios. So if you're constantly stressed, oftentimes people complain about grinding their teeth at night or clenching their teeth, or a spouse will complain that their significant other is doing that while they're sleeping. It can be kind of disturbing, and then you can wake up with that pain within the jaw itself, which is uncomfortable throughout the whole day. Whether you're talking, you're eating, doing your daily activities, it can cause headaches. So the pain, whether it's on one side or the other, or even both sides, it can cause you to have a headache, whether it's in this area or really anywhere within the head. That headache can occur. So the thing that with TMJ dysfunction, there's a disc within the mandible itself, so this bone right down here, and then the skull, where that joint articulates, there's a little bit of a disc in between. And if that disc is either degenerating, so there's less space within that joint, that can cause pain, muscles to be tense throughout that area. It can cause also popping or clicking sensation with degeneration, so there's damage through that joint. That damage can be caused by just the grinding of the teeth, which happens at night, that constant clenching, or if for some reason you had some type of trauma to the jaw, that can also damage that little disc within the temporomandibular joint. Other things that can happen with that disc, it can be pushed backwards, it can be pushed forward, and with it being pushed backward or forward, sometimes as people try to open their mouth, it's a locking sensation, whether they can't get their jaw to open all the way. So a simple test is, can you fit two fingers up and down this way within your mouth? If you can, that's good. Ideally, you should be able to get three. If you can't get the three, then the jaw is not opening the way that it needs to. With that disc, it can also cause the jaw to lock open or lock closed. So some people come in complaining about their jaw locking up when they're eating, when they're yawning, or even at night when they're sleeping because of the grinding of the teeth that they have. Some things that can be done for this. Oftentimes people go to their dentist and they'll get a guard to help with reducing the amount of grinding that they're doing at night. Those guards can be expensive, so not everybody decides to get those. Things that we tend to do in the office here for someone that comes in with TMJ pain, there are muscle releases that can be done throughout that area. Oftentimes there's a muscle imbalance from one side to the other, so if you watch your jaw in a mirror, watch yourself open the mouth, sometimes the jaw will deviate from one side to another, or it'll jut to one side and then come back to the center line. There's a couple different variations. The one is, like I just mentioned, where it juts to one side and then comes back to center as you're depressing your jaw. The other option that can happen is your jaw can just deviate and shift down to the one side or the other side and stay that way as you're depressing the jaw. So there's different things that are associated with each of those conditions. Sometimes it's related to that disc that I mentioned, and sometimes it's related to a muscular imbalance, whether one muscle is tight or there's a weakness within the muscle that are surrounding the jaw itself to help with opening and closing the mouth. So things we do muscle releases into that area to help reduce some of that tension around the joint itself. We can use our K-laser to help reduce any inflammation that's caused within that area from the grinding of the teeth, that constant pressure up along that disc, and then also we can do an adjustment to the jaw if it's needed, or an adjustment to the cervical spine and the neck, because a lot of those muscles in the joint itself is associated with some of those areas. So adjusting may be necessary if it's assessed and not moving the way it needs to be moving. So those are just simple things that we tend to do in the office. We usually have pretty good success treating people that come in the office that have TMJ problems. It's not a common thing that people think about a chiropractor to go to, so that's why I decided to do this video today on it. So if you're experiencing any pain within the jaw, if you grind your teeth at night, if you have headaches because of anything that's associated with the jaw, feel free to stop in, feel free to comment on the video. I can answer any questions that you guys may have, whether it's treatment related or if you're not sure if the symptoms you're having are something that we can treat. So this is the Elite Education Series, today talking about TMJ, temporomandibular joint dysfunction. I hope you join us next Thursday around 12:30 for next week's topic.